the Nagar branch, I, Sara Puri, extend a very warm and enthusiastic welcome to the respected directors, Dr. Anil Singla sir, Dr. Vikas Jindal sir, our respected principal, Dr. Baljit Singh sir, esteemed faculty members, students, interns, and participants joining us today for the second session of our World No Tobacco Month 2026 online lecture series. Our lecture series began with an insightful first session conducted by Dr. Swati Sharma on the 27th, and today we gathered here for the second session of the important academic initiative. It is truly wonderful to witness such enthusiastic participation from all of you for a cause that holds immense importance in today's healthcare scenario. Before proceeding further, I would now like to respectfully invite our esteemed principal, Dr. Baljit Singh sir, to formally welcome our keynote speaker for today's session, Dr. Karandeep Singh Sandhu sir. Over to you, sir.
Thank you so much, Sara.
Thank
Thank you. And I must compliment you also. Your presentation is really very nice, and I am so glad to see all my students. They are so talented. God bless you all. You are doing good job. Okay. So let me first of all welcome our esteemed speaker, Dr. Karandeep Singh Sandhu.
Thank you very much,
Karan,
sir.
you are very warm and cordial welcome to you from the team HDC.
Thank you very much, sir. Thank you very much.
And we are really honored to have you on this platform. As I mentioned, I don't know whether you were there last evening. We had a wonderful session by Dr.
Swati.
Swati Sharma. Okay.
Yes, sir.
It was really good. And there also I mentioned that this menace of tobacco, this is a menace which I consider, in fact, in reality also, it is a preventable menace. And this is something which definitely can be, this is a preventable menace, which can definitely be prevented. And the best mode for this probably can be the counseling of the people who are consuming tobacco, of course, and the population in general also. And I hope that Dr. Sandhu, he will do justice with this particular topic where he's going to touch regarding this counseling related to the various tobacco habits. So once again, warm welcome, Dr. Sandhu. And at the same time, today again, I appreciate the Department of Public Health Dentistry led by none other than my younger brother, Dr. Sahil Thakkar, a very, very talented and devoted a team member of Himachal Dental College, Sundarnagar, for having all such programs in our institute. And I definitely believe that my students, they are definitely going to gain through this, all these exposures which they are getting. So best wishes to you, Dr. Sandhu, and the entire team of Department of Public Health Dentistry. Thank you.
Thank you very much, sir. Thank you very much, sir.
Thank you very much for your kind words, sir. Before we ask Dr. Sara to continue with the event, Dr. Karan sir has his own event going on, Perio Parichaya, and we're very thankful to sir to take out time from his busy schedule today, sir. We would like sir to present the certificate to you before we start the event, but I think sir is very busy with his own event. So, sir,
kindly excuse me, Dr. Karan, on behalf of Himachal Dental College, Sundarnagar, I am really honored to present this certificate to you. And once again, my best wishes to you.
Thank you very much, sir. Thank you very much for providing us this nice platform to share our skills and views for students so that they can be better counselors for tobacco cessation. Thank you very much, sir.
Yeah, please go ahead.
And sir, this is for Dr. Sara, our moderator for today, sir. Another certificate for her all hard work that she's put in for today.
Sara, you are getting this certificate deservingly, so you know.
Thank you, sir.
Eh?
Thank you, sir.
God bless you and keep it up. Team HDC is proud of you all.
Thank you so much, sir.
Okay.
Right. Thank you, sir. Thank you very much. I think, Sara, over to you. And sir, we can start with the proceedings now for the lecture, sir.
Okay. Yes, please.
Yeah, please, Sara,
Thank you
continue,
so much,
please.
sir. Thank you so much, sir. Now, coming to today's session, today's lecture is on highly relevant and insightful topic, that is role of counseling in tobacco cessation. And for this wonderful session, we are truly honored to have with us an esteemed academician and speaker, Dr. Karandeep Singh Sandhu, sir. It is my privilege and pleasure to introduce our respected speaker for today's webinar.
Thank you very much, Sara, for such a nice introduction.
Thank you, sir. Uh, so, Dr. Sandu is currently serving as a reader in the Department of Public Health Dentistry at National Dental College and Hospital, Dera, Bassi. He brings with him over 5 years of dedicated academic and clinical teaching experience at Sri Sukhmani Dental College and Hospital, Dera, Bassi. He completed his Bachelor of Dental Surgery from Adesh Institute of Dental Sciences and Research, Bathinda, and pursued his Master of Dental Surgery in Public Health Dentistry from Swami Devi Dayal Hospital and Dental College, Panchkula. Adding to his strong academic background, he has also earned qualifications in hospital and healthcare management, including a postgraduate diploma and doctorate in management studies in healthcare management. His professional interests extend into tobacco control and cessation, for which he has completed certified training programs as well. Dr. Sandhu has contributed significantly to research and academics with multiple publications in national and international journals on topics including oral health literacy, oral cancer awareness, dental insurance, occupational stress, and public health dentistry. He has actively presented papers and posters at prestigious conferences as well, including the FDI Annual World Dental Congress and various national conferences of Indian Association of Public Health Dentistry. Apart from academics and research, he has been deeply involved in community outreach through dental camps, oral cancer screening programs, anti tobacco campaigns, and public awareness initiatives. He was also awarded the Best Postgraduate Student in Public Health Dentistry at the 8th International Dental Student and Second Dental Surgeons Congress in 2016. Today, we are fortunate to have such an accomplished academician, researcher, and public health professional with us. Without any further delay, I would now like to invite Dr. Karandeep Singh Sandhu, sir, to deliver his lecture on role of counseling in tobacco cessation. Over to you, sir.
Thank you very much, Sara, for such a detailed introduction. And thank you, Sahil, sir, for inviting me as speaker and always being my torchbearer in public health dentistry since my PG days. Thank you very much, sir.
Well, I think since before we start, I must tell the students that Dr. Karan was a postgraduate student third year when I freshly joined as a lecturer. And since we've been associated in all our public health related activities, one thing that the students should know that Karan sir went to London and he did his integrated MPH there, and he was a research scholar there also. So he has pretty good international exposure, and he's a speaker. He's been going to various institutes for his lecture. So we're very happy to have you. And as a student, Dr. Karan, although we are just 1 year, you're just 1 year junior to you, but seeing the accomplishments that you have done, it makes us really very proud to have you amongst us. And how you are elevating public health dentistry across the country and Punjab region especially. So thank you very much and welcome. We're looking forward to your lecture now.
Thank you very much, sir. Thank you very much, sir. Let me share my screen. Yeah. Sara, can you confirm, is my screen visible?
Yes, sir, it is.
It is. So good evening, everyone. Am I audible enough?
Yes, you are. Dr. Karan, if you could just put the presentation on slideshow.
Yeah. Is it fine, sir?
I think it's still not on slideshow. It might take some time, but yeah, it's not on slideshow. But we can see the PPT as such. Yeah, it's come. We can start. You can just yes, please.
Okay, so let me start with some facts. Like, as we all know that tobacco use remain one of the leading preventable cause of death, as it is associated with various life-threatening conditions such as cancer, heart diseases, and respiratory diseases. So as we are all dentists, and our role as a first-line healthcare worker to diagnose oral conditions, So we need to be better equipped with skills so that we can be a better counselor. Okay, so that we can be the best first line counselor to counsel patients about tobacco cessation. Even a brief counseling session can influence a patient to make a decision to quit smoking or smoke less tobacco. Okay? So let me start with some facts, alarming facts of GATS India survey. Yes. So basically, GATS survey was done in India. It is about the global adult tobacco use survey. It was done in 2009 and 10. It was first global tobacco survey, and the second one was done in 2016 and 2017. So what was the findings? The findings say that 34.6% of adults use tobacco from the tobacco, from smokeless and smoking tobacco. Smokeless tobacco was more common in India, but only 5% of users get cessation advice from a health professional. This is due to the lack of awareness. But after a few years, after 6 years, when GATS 2 was done, so prevalence fell to 28.6%. Then more than 55% of current users want to quit. This is due to the awareness. People become more aware, more services started to booming up. So people show the need for tobacco cessation counseling. So what the gap identified that many users want to quit, but only 1 in 3 got professional cessation support. This is due to the lack of cessation services in our country at that time. So why counseling is critical for tobacco cessation? Why counseling matters? First thing is that tobacco is an addiction. We all know that tobacco is the smoking contain nicotine, which is an addictive substance, which is more addictive than alcohol, because nicotine crosses the blood-brain barrier within 6 to 7 seconds. So nicotine dependence is a long-term condition that often comes back with relapse. So one cannot stop smoking or smokeless tobacco with willpower alone. Research states that only 3 to 5% people were used to quit smoking only using the willpower. This is very less percentage. So counseling greatly improved their quit success. Second, we as a dentist can directly inspect the oral cavity, direct oral impact. Dentists can see tobacco related oral lesions. This gives them a strong visual reason to help patient quit. Next is trusted relationship. Patient often have a trusted relationship with the dentist. So patient often trust their dentist. A brief, kind and non-judgmental message can motivate them to quit. Next, we have the evidence. We have evidence-based research that brief counseling by a healthcare provider, maybe a dentist or any healthcare provider, can increase the chances of quitting smoking or smokeless tobacco by 1.5 to 3%. So next, moving to the what are the qualities that are required for a tobacco cessation counselor. He or she should be empathetic and non-judgmental. By empathy, I mean that he should understand in what condition patient is, in what circumstances he is using tobacco, what circumstances are prohibiting him or her to stop using tobacco. For example, if a patient is using tobacco because he is in stress, we can't just say that you should stop smoking, you can't deal with stress like this. We must be empathetic. We must think that in what situation and what situations motivated him to use tobacco. And we should not be a judgmental. We should not be make a judgment that patient is using tobacco, he is a chronic user. We should always be positive affirmation with him, that we should motivate him at every step that you can stop tobacco. Many people have stopped using tobacco. Don't worry about the relapse. You can do. We should be motivating at every step. Second is clear communication. Explain health risk in simple, respectful language. Use the patient's own words and clear examples they can relate to. Right? You can give the example. There are many patients in your clinic who has who were previously using tobacco, that more than 20 cigarettes per day, but they have successfully quitted now. You can clearly give them examples. Then the best counselor should have a clinical knowledge to know the main tobacco products, which tobacco product he is using, either it's smoking or smokeless, what are the health effects, what are the pharmacotherapy options we have, like NRTs and antidepressant drugs, and what behavior change techniques we can do for them, like how we can do behavior counseling with them. Next is patients. So the counseling involves like regular follow-up. We have to do 6 to 10 follow-ups with the patient. So you need to be patient. Patient will not abruptly reduce cigarette from 20 to 0. Patient will slowly cut down. So you need to be patient with the patient, okay? And persistence. So you need to be keep follow up, keep going in a flow and keep following up the patient, like every week, every month, then after 6 months, until the patients quit with their withdrawal symptoms. Next is motivational skill. Find what matter most to the patient, such as health, family, money, or appearance. Bring it up at each visit. Like somebody is smoking, you can motivate him that the smoking is not good, as you are smoking in the home, your children and family is also getting affected. Okay, and if the person's health is suffering, like patient is having risk like short term, like breathlessness, you can also always start with that motivation skills, that you can improve your health and you can improve your family, or you can save your money, and you can start with this every time patient visit you. Next is confidentiality and trust. Keep patient information private. Patients are more likely to be honest when they trust their care provider. So you need to be confidential with patient, and you should provide them credible information so that they can trust you. So next is, I will explain you the model of changes, that is 5 stages of change. How person can change from not being a smoker to being a non-smoker at all. So for any addiction, maybe it's alcohol addiction, smoking addiction, there are 5 phases as developed by Prochaska and D. Clementi in 1983. First stage is pre-contemplation stage. For example, patient visits you for a first time for a dental checkup, right? And you have noticed some signs like white patches. You all ask patient that, I have noticed some signs. Are you using any tobacco or any form? A patient will say yes. But then you will realize that patients will explain his or her reasons why he is using. And he's not ready to quit at all. He's not thinking about quitting. That stage is called pre-contemplation. Next stage is contemplation. Contemplation is, you have motivated patients, that you have told patient about the risk, its ill effects, or short-term effect, long-term effect, and patient started thinking about quitting. That is contemplation, that within next 6 months, but not immediately. That is contemplation. The third stage is preparation. Patient is actually planning to quit within next 30 days, or you can set a quit date. Date can vary. It can be 2 weeks from your first visit, and it can be 30 days. Okay. Next is action. And patient has actively quit smoking now. He is a non-smoker now. At that stage, he need maximum support so that he can deal with withdrawal symptoms, and he should not go into the last stage, that is relapse, right? Next is maintenance. If the patient has quit smoking for 6 months, there are very much chances that he will be a non-smoker for whole of the life. So the last stage is maintenance. So our counseling will coincide with these stages. So understanding each stage and how we need to counsel. First is pre-contemplation. Pre-contemplation, as I already stated, patient does not want to quit yet. So what we can do is, we can share the facts. Means patient is not ready to quit. He say that he wants to go to night shift, so he uses tobacco, so he uses canny, right? He used to wake whole night. You can just share the fact that there are facts that patients who are using this chani canny or tobacco at night, they got oral cancer. Okay. There are alternative ways I can help you with the alternative ways so that you can deal with. Next stage is contemplation. Patient is thinking about quitting. The next stage is contemplation. Patient started thinking about quitting. So you need to explore pros and cons. Use motivational interviewing, point out health risk and benefit. At this stage, patient has shown some willingness to quit. So you need to show the motivational interview. What is motivational interviewing is that 5 A's and 5 R's that we'll discuss in the next slides, upcoming slides. Next is preparation. Patient has decided to quit. Now patient has finally decided to quit because you have counseled him very nicely. Then what you can do is you and the patient can agree on a quit date, which should be 2 weeks from your last visit. Discuss pharmacotherapy. You can discuss what options are available, how he can or she can deal with nicotine withdrawal symptoms by using nicotine patches, nicotine gum, right? Identify triggers and coping strategies. You need to document what are the trigger factors. Trigger factors can be the peer pressures, or the trigger factor can be the stress, and how you can cope with that strategies. Next will be the action, the actual stage when patient has recently quit. Give strong support, check withdrawal symptoms. You can give strong supports by regularly follow up with the patient. You can physically follow up with the patients, or you can email or use the telephone lines to make follow up so that he can deal with withdrawal symptoms with your support. Adjust pharmacotherapy if needed. Like first we start with lower dose of nicotine gums and nicotine patches. If needed, we can increase the dose, right? So that he or she cannot suffer from withdrawal symptoms of nicotine. The last stage is maintenance phase. Patient has been a tobacco free for 6 plus months. Now he has left smoking and 6 months has passed. He's not smoking. So reinforce success. You need to refund him and congratulate him on his success. Review relapse prevention. Review the factors which can trigger him, which can bring relapse. Keep long-term follow-up. Keep long-term follow-up means that you need to follow up after every month. Then you can follow up him after every 6 months, then after 12 months. Remember that relapse is not a failure. It's a normal process of change. Most tobacco users make 8 to 10 quit attempts before they quit for good. So each try teaches something useful. So don't take relapse as a failure. You should motivate patient at each and every step so that ultimately your goal is to make patient tobacco free. So what are the 5 A's approach for tobacco cessation? You all might have read this in your book, the 5 A approach for tobacco cessation. So 5A, we start with ask, like screen every patient. Suppose patient visit you for scaling or for any treatment and you notice some patches. Later, I will discuss with you an example, a clinical example, how we can ask a patient. So screen every patient, ask every patient about tobacco use at every visit. Treat it like a vital sign. So you can ask him, do you use any form of tobacco products, whether he might be using smoking. If he is smoking, how many pack of cigarette you are smoking a day, for how long you are smoking. You can ask, how have you ever made a quit attempt? What are the triggers? Okay. What are the roadblocks? These all things come in ask. Next is advice. If you notice some patches and you have noticed that he is suffering from periodontitis, bad breath, stained teeth, advise him, give him clear advice, give him a clear direct message to quit. As your dentist, I strongly advise you to quit. Tobacco is already affecting your gums and oral tissues. Okay. Next thing is assess. Just assess how much patient is ready to quit. As we discussed the stages, is the patient is in contemplation stage, in action stage or maintenance stage. Okay. Because for contemplation and pre-contemplation stage, the patient is not ready to quit. So for these type of patient, we use 5R techniques. So we use 5A techniques only the patients who are in preparation stage. Check if the patient is ready to make a quit attempt. Ask him, are you willing to set a quit date within next 30 days? This links to the stages of change model. As I already said, like only use 5R if the patient is in preparation stage, like if he wants to quit smoking within next 30 days. Next important thing is assist, help with the quit plan. For ready patients, help set a quit date. First and foremost is set the quit date. Then explain him that after quitting, you will suffer from withdrawal symptoms. Then you need to assist him how to deal with withdrawal symptoms. So it is better to involve patients, family, and friend so that they can better support with him. Tell the patients that throw the products, tobacco products, throw cigarette boxes, anything which triggers him to, which make him to smoke again, right? Next is arrange follow-up. Follow-up is very important because if you do not follow up, patient will surely fall to relapse again. So research so that follow-up is the more important than other A's. Like plan follow-up contact, do this in a first week after the quit date. When the patient had quit smoking, the next follow-up should be within the first week so that you can better assess how the patient is dealing with the withdrawal symptoms. Withdrawal symptoms might be like irritability, patient can be feeling low, patient can be facing the symptoms of insomnia, irritability. Okay. So follow-up is very important. You can support the patient through follow-up to deal with the withdrawal symptoms. So I will give you an example like how we can put 5 ways in practice. This is an example like consider a 35-year-old male patient coming for scaling. So he has been chewing gutka for 12 years. Here is how the 5A apply in routine dental visits. So in first visit, you can ask the patient like, Mr. Sharma, do you use any tobacco or gutka products? Record the type. Is he smoking? Is he using gutka products? Is he using any other form of smokeless tobacco? How often he uses it and for how long? Next is advice. You know now patient is using the tobacco. You have asked him for how long he is using. Did he made ever a quit attempt? Then you can advise. So then you can say that, sir, I can see white patches in your mouth. Gutka can cause this and can lead to cancer. You should stop. You should give him a clear advice that the most important thing at this stage is you should stop using smokeless tobacco or smoking. Third is assess. Third, you can assess by asking, are you thinking about quitting? Would you be willing to quit? Will you be willing to set a quit date this month? Quit date can be any date from 14 days to 30 days. Check readiness to quit. Ask patient, are you ready to quit within these days? If the patient is ready to quit, go to next step, assist with him. Assist with the written quit plan. Discuss nicotine replacement therapy. Advise patient how can he deal with the withdrawal symptoms, what other options are available, how can family support him, how can he deal with the stress, what are other coping strategies like he can use somf if he using smokeless gutka, he can use a sip of water, he can do his favorite hobby activity, okay, just to cope up with withdrawal symptoms. Then he can refer to a quit line like National Tobacco Quit Line Service. Our India has National Tobacco Quit Line number. He can get counseling from there as well. The next and the most important step is arrange follow-up. Book follow-up in 1 week after the quit date to check how patient is dealing with the withdrawal symptoms. Next is the 5R approach. This is for motivating the patients who are unwilling to quit. That is the patient who are in contemplation, pre-contemplation and contemplation stage. So what does 5R in detail? So 5R start with relevance. We need to ask the patient that, can you identify why smoking is relevant to you? Help the patient to find personal reasons to quit. It may be the family reason, maybe the financial reasons, or maybe the health reason. Ask why quitting matter to them. It could be family, health, money, or appearance. Next is the risk. Ask a patient if he or she knows what are the risks of using tobacco. Risk can be the short-term risk like bad breath and staining of teeth, and your heartbeat is always increased. Also include long-term risk like oral cancer, COPD, and heart disease, so that patient can be made better aware of the risk associated with tobacco use. Next are these rewards. Talk about the benefit of quitting. For example, what will happen if the patient will quit smoking or quit using smokeless tobacco? The patient will patient will smell better, and the taste will become better, and money is saved. Lot of money will be saved because the cigarette smoking is very costly. Lower cancer risk. You will get your body will get normal, your blood will get normal level of oxygen, carbon monoxide level will be decreased, right? And the chances of heart attack will be reduced to half, and it will also benefit your children, and you will have a longer life. Next are is we need to identify the roadblocks. Roadblocks means what are the barriers which are which patient is finding difficult to quit tobacco. So find the barriers to quit. Common ones are withdrawal symptoms, like it is very difficult for some patient to deal with the withdrawal symptoms. Second most common is weight gain, as smoking increases the BMI, so increases the body mass metabolic rate. So after when you quit smoking, there is some weight gain as body become to the normal level. Your heartbeat become normal, and the body mass index become normal, and your BMR rate also increases. So there is some weight gain which you can manage with exercise and other coping strategies. Next is stress and social pressures, and low sport and the cost of NRT. Some patients find that NRT is costly. So these are the common roadblocks for quitting smoking. So give them practical help for each step. Next is repetition. This is again important. Repeat the 5 hours at every visit. Each time it can strengthen motivation. So patient will come to you for next visit. Give him that follow-up date within 1 week, okay, so that he can come. So when he comes, you need to repeat all the 5 hours again, so that you can motivate him to change his or her habit, or change the stage. He can come from contemplation stage to preparation stage. So this is again an example of 5R, a clinical example. So for a patient in pre-contemplation or contemplation stage, that is pre-contemplation, he is not even thinking about quitting smoking. Contemplation, he just started about quitting smoking, and give him a brief 3 to 5 minute 5R approach. So this is an example. So what does the dentist say? Relevance. This is just an example. You said your daughter's wedding is in next year. How would quitting smoke tobacco help you for that day? This is relevance. Relevance. Why it is relevant? Because that person's daughter wedding is coming. So he wants to quit smoking. He wants to look nicer. He wants to look his appearance better. He wants to like his mouth should not smell. Okay. So next, come to the risk. If you have identified a white patch or white lesion, then ask him risk, like this white patch OSMF can turn into cancer. Gutka is causing this, as he is using gutka, right? Ask him to identify what the white patch can do. So you can tell him this white patch can be dangerous. It can turn into cancer. Third is reward. If you quit now, this lesion may improve. Your mouth can start to heal. If you quit, your mouth will start to heal, and your mouth will start to heal, and you will become normal and your teeth will get less strained. Next, roadblocks. What is stopping you from quitting right now? What are the roadblocks which is stopping him from quitting now? You can ask him. Third is repeat. Repeat. Give him assurance that we will talk about this again at your next visit. No pressure, but we will keep helping you. We will keep helping you at every visit. So this is very important. That repetition is very important at every visit, so that you can make up, the patient can make up the mind to change his stage from pre-contemplation to action stage or preparation stage. So why this 5 hour work? The 5 hours are patient centered. The patient does the thinking, not the healthcare provider. You ask patient to identify why it is relevant to you. You ask patient to identify the risk and reward and roadblock. So why? So that's why 5 hours are effective. They can work. Studies show that even short motivation talk repeated over several visits increase quit attempt compared with no counseling. If you do even a brief 3 to 5 minute counseling, it can help patient to quit tobacco. So next is when to use 5A and 5R approach, that I have already told you. When the patient is in preparation and action stage, that is patient has made up his or her mind to quit smoking, then use 5A approach. If the patient is in pre-contemplation or contemplation stage, that is not even thinking about changing his habit, then use 5R approach. Next, I will give you a brief introduction about the pharmacotherapy, because research states that counseling plus pharmacotherapy is the best approach for someone to quit smoking. Not only pharmacotherapy can help and not only counseling can help, but the combined approach can help patient to quit smoking. Right. So we all know that there are many first-line pharmacotherapy products which provide constant smoking, but in lower amount, like nicotine patch, nicotine gum, nicotine lozenges, nicotine inhaler, and nicotine spray. There are some newer products like nicotine pouches, but these are not recommended and they are not like ready for use in India. But they provide like small little and constant use of nicotine so that patient can deal with withdrawal symptoms. So how we can assess nicotine dependence? So we have a practical test for that. This is called Suggestion test of nicotine dependence, because during the assessing stage of 5AR, we need to assess patient is at what stage of nicotine dependence. So there are few questions in it that you can ask patient. How soon after waking do you smoke your first cigarette? Do you find it hard to avoid smoking in no smoking areas? Which cigarette would you miss the most? Like if the person is hard smoker, they will miss their morning cigarette most. How many cigarettes do you smoke each day? If the patient is using like 20 cigarette a day or 20 to 20, less than 20 cigarette a day, he is like moderate smoker. If he is using more than 25 cigarette a day, he is rated as high smoker. Do you smoke more in the morning than later in the day? Because heavy smokers will start smoking within 30 minutes of waking up. Do you smoke even when you are sick and in bed? So why we ask this question? Because we can interpret the scores. If the score come to 0 to 2, that means very low dependence. Then counseling only is enough. Patient is on very low dependence, means patient is using 1 to 2 cigarettes per a day. That too occasionally. You can counsel him about the ill effects. Right? You can use the same 5A and 5R approach. Right? Next, 3 to 4, low dependence. 3 to 4 is low dependence, brief NRT along with counseling. Right? If patient is score is 5 to 6, that is moderate dependence, then NRT is strongly recommended, because patient will surely suffer from withdrawal symptoms. So you need to provide him continuous dose of nicotine through NRT. 7 to 10 is heavy dependence. So we can use combination of NRT or varenicline. Varenicline is a FDA approved drug which you can use. If it acts as a a nicotine receptor antagonist. So it binds to the receptors which nicotine binds, and you will feel the same euphoric effect with varenicline. Right? So why counseling plus pharmacotherapy is the best approach? Neither counseling nor pharmacotherapy alone give the best quit rates. The strongest clinical evidence support a combined approach as gold standard for tobacco cessation. This is again why we need to think upon, because pharmacotherapy address the brain. It deals with the brain. Nicotine addiction changes the brain's reward pathway. So what NRT do? NRT provide nicotine, right? And varenicline help to reduce the urge to smoke or chew as it binds to the nicotine receptors. So pharmacotherapy address the brain part, and the second part, counseling address the behavior. So both are important. So tobacco use is tied to daily habits, stress, and social settings that you cannot change with the pharmacotherapy. That's why you need counseling. So behavior counseling help identify triggers and build coping skills. So together addressing the whole patient. So this is a biophysiological model which addresses brain as well as the behavior. So medication help with craving while counseling support behavior and social pressures. This lowers early relapse and long-term reoccurrence. Right? So if you use pharmacotherapy plus counseling, there are more chances that patient will quit tobacco. So how we address relapse? So we will, if you start counseling, you will often see that patient will not be successful. Patient will take 8 to 10 attempts to be successful to become a non-smoker. So relapse is a normal condition. It should be seen as a part of quitting, not as a failure. So healthcare provider, what we should do, support the patient with care and new plan. We can make changes to pharmacotherapy. Okay. We can make more frequent visits for follow-ups. Okay. So common relapse triggers like stress or emotional upset. Maybe a patient got to go stress again, social events and peer pressure like any parties, alcohol use, because alcohol has a synergistic effect. So alcohol users are very hard to quit smoking. So withdrawal symptoms like irritability or weight gain problem, and feeling good and celebrating. Just to feel good, patient can go to relapse stage. So how post-relapse counseling strategy work? When a patient relapses, use a non-judgmental, solution-focused approach. Acknowledge the relapse without blame. Make patient so that comfortable, and acknowledge that the relapse is not a failure. It's just a common thing. We will help you to deal with that. Ask what triggered it. What are the triggering point? Like is he suffering from any stress, or he has done relapse under peer pressure? Recognize the time they stayed quit. Just assure them that like if the person has stayed quit for 1 or 2 years, just recognize him, just congratulate him. You can do it because previously you stayed tobacco free for 2 years. Review and update the quit plan. That is, you can make more frequent follow-ups, consider a stronger pharmacotherapy, set a new quit date, and keep moving forward. Right? So it's a continuous process. Okay? You should support the patient till he or she stops smoking or smoke less tobacco. So why we as a dentist has a unique advantage? First thing is that no physician, any cardiologist or oncologist can show a patient the damage tobacco is doing right now in real time as clearly a dentist can do, because mouth is the mirror. So we can use our because patient visit us and oral cavity is the first thing we examine, and the signs and symptoms start with the oral cavity. Right? This direct view makes the dentist a strong suggestion counselor, okay? Because dentist is the first one to see and acknowledge the symptoms. When patients see their own white patches, receding gums or staining, and hear that tobacco caused it, the message feel immediate and personal. So what does the research say? So if the patient visits dentist, the patient is 3 times more likely to quit patient who get dental suggestion advice compared with no advice, 3 times more. And 90% oral cancer link, because smokeless tobacco is linked with oral cancer, as Indians consume most oral cancer in the world, next only to China. So 90% of the oral cancer is linked to using smokeless tobacco. And as the Gate survey has told us that we can find the findings that 55% want to quit. So we can counsel them. Only thing lacking is that they don't know the direction, how they can quit smoking, how they can get the support from, or how they can get counsel for that. So 55% want to quit smoking. So this make dentist in a unique position to be a better counselor. So what are the resources from our government? So national tobacco cessation resources in India. So government also helping and providing support. First is the national quit line and national tobacco quit line. Here trained counselor will give full support in every Indian languages, and it is available in all states. Second program started by Ministry of Health and Family Welfare is M Cessation program. What they do is they can get continued SMS support from trained counselors. So messages are sent for 6 months. Right? Next is tobacco cessation centers, as we have in our dental colleges. So tobacco cessation centers are now created in all medical colleges and district hospital across India. They provide counseling and medicines like NRT. Next is National Tobacco Control Program. Under this program, there are national tobacco cells in every state and district wise, which can help you with the medicines like NRT and provide you trained professional support. So why documentation and record keeping in necessary in suggestion counseling? What to document? Like you need to have a documentation so that you can't suffer from any legal to protect yourself from any legal proceedings and help a patient in the ongoing care. So what to document? Like type, frequency and duration of tobacco use, whether he's using smokeless tobacco, in what form, and for how long he's using the tobacco. Next is Fagestrom scale. As we have assessed Fagestrom scale, how much is he or her is dependence level. Next is the stage of change at every visit. In which stage the patient is when he visits you, whether he is in the preparation stage, whether he is in the action stage, whether he is in the maintenance phase. Next is counseling approach. Which counseling approach you have used? Is it 5R or 5A? Next, the pharmacotherapy which you have prescribed, like dose and duration, like which you if you have prescribed nicotine gum, what dosage you have prescribed, as it usually comes in 2 milligram and 4 milligram dosage, and for how much period. Next is patient response and quit date set. When you have agreed with the patient to set the quit date, it can be 2 weeks, it can be 30 days. Next, follow-up dates and outcome. How much follow-up you have done and what are the outcome at each and every visit. Next is the dentist role in India tobacco control policy. What dentist can do? We as a dentist can actively support policy advocacy. We can support COTPA enforcement, like pictorial warning, no tobacco sales near school. So what we can support is that we can display signs near our clinics like no tobacco area, smoking here is prohibited. Next is community outreach activities, which we are already doing in academic institutions. Join World No Tobacco Day events, school health programs, rural health camps, take suggestion messages beyond the clinic. We need to reach the community. Third is research and documentation. Record suggestion result in your practice. Add to national research data on tobacco suggestion, which is still limited. So we can record and research like how many counseling we have done and what is the outcome, how much successful rate we are. We can record and document it for the research purpose. Next is role model. Obviously, dentist who knows all the harmful effects of tobacco, dentist should be a non-smoker. So dentist who use tobacco and send the wrong message. So tobacco-free dentist and tobacco-free dental institution support the credible counseling. So last, coming to conclusion, counseling is a core clinical skill. So we need to have a skill of counseling. It's just not an extra skill added to dentistry, but it must be the core clinical skill. It- Because tobacco use is common in our country, and as a dentist, we are first line healthcare workers to spot lesions, and we can be a very good counselors. So how it can help patients? A clear suggestion talk during a dental visit can be a moment a patient decide to quit. If you give a clear message, there can be a chances that patient is motivated with your talk and he can be a tobacco quitter very soon. For the professional, dentists who use 5A and 5R approach and pharmacotherapy move beyond treating oral diseases. So we move beyond treating oral diseases because here we are showing our preventive approach. This helps to deliver whole person preventive approach so that person can be prevented from oral diseases. For India, if every dentist consult just one tobacco using patient each day, India's 267 million tobacco users, which Gates survey has indicated, would have far better access to proven cessation sports. That is why counseling is very important, and this is the skill we need to learn in our dental curriculum. Thank you.
Thank you so much, sir, for such an insightful and enlightening session. Your guidance on the importance of counseling and patient communication in dental cessation was truly informative, and will definitely help all of us in our future clinical practice as well. We sincerely appreciate the time
Thank
and
you.
effort you dedicated. Thank you,
Thank
sir.
you very much, sir. Thank you very much, sir.
Shall we now begin with the question and answer session?
Yeah, I'm okay.
Okay, sir. So the participants who wish to ask questions, kindly use the raise hand feature or type their questions in the chat box. I will read out your questions to sir, and he will be happy to answer all your queries. Uh, S- Sahil, sir, you need to unmute yourself. Yes, sir.
Oh, I'm very sorry. So a few takeaways from Dr. Karan's lecture, that we all are tobacco cessation counselors, and in public health dentistry we do that. But Dr. Karan, I think you said one thing in the beginning of your lecture only, that apart from being empathetic, that everybody does, it is important for us to be non-judgmental, and
Yeah.
that really is something that now we need to learn apart from empathy. So I think a few years ago we focused on empathy for undergraduate training or teaching them, but now being non-judgmental is something that we need to again introduce into our curriculum or to the teachings to our students, that this is more important than empathy. This is what I guess. And yes, sir did say one thing that again is very nice and very apt, that a patient might take 8 to 10 times to quit. So we should know the difference between a lapse and a relapse. And sir would agree that if a patient is a quitter for, let's say, 10 days, and he or she has the first cigarette after 10 days, so you should encourage the patient that, okay, this might be a lapse, it is not a relapse, start again, but do not take up this habit again. Just because you've had one does not mean you have failed. Just continue and do not start that habit again. Very much. And
Right.
again, sir, I would like to say, Dr. Karan, again, in the end, you said that tobacco cessation is a core clinical skill that should be taught. And in a clinical practice, irrespective of the branch that we are in, that should be our motto, that we have to provide tobacco cessation counseling to the patient that comes to a clinic for that matter. So I think a wonderful lecture given by you, a lot of learnings, 5 A's, 5 R's, 5 D's given by you, 5 R's. So these are very, very basic skills, and I am happy that through you, our students could learn them. at the very beginning of their undergraduate life. So we have first year, second year, third year interns. So something that it is a key takeaway message for them. And of course, we'll be sharing the lecture on YouTube, so they can refer to your lecture whenever they want to, and so can your students. So if you don't have any questions, Dr. Sara, we can just thank Sir for and conclude the event.
Okay, sir.
Thank you very much, sir.
Thank you so much, sir, again for such a wonderful and interactive session. The way you explained the importance of counseling in tobacco cessation with such practical and relatable examples made the session truly engaging and insightful for all of us. I'm sure everyone present here has learned something valuable today, and this will definitely help us not only in our professional journey, but also in creating a positive impact on our patients and community.
Thank you very much, Sara. Thank you very
Thank
much.
you, sir. So, on behalf of Department of Public Health Dentistry, Himachal Dental College, Sundarnagar, and IDA Sundarnagar branch, I would like to express our heartfelt gratitude to Dr. Karandeep Singh Sandhu, sir, for sparing his valuable time and sharing his knowledge, insights, and experience with us this evening. Thank you
Thank
so
you
much.
very much. Thank you very much, Sara. Thank you very
Thank
much,
you,
sir.
Doctor. In the meanwhile, Dr. Sara, if you could tell them that we share the feedback link in the chat box.
Sure,
So
sure, sir.
participants, before you leave, please fill the feedback form. Dr. Karan sir, your certificate is with us. We'll mail you, but we'll mail you along with the YouTube link. So it might take 24 hours for us to mail you the certificate,
No
and
worries, sir.
we'll send it to you. And calling you Dr. Karan, and the way we talk on this platform is different, but we're more like brothers.
Yeah,
So
I'm
दिल तो
just
धन्यवाद
like a younger
प्रभा
brother.
दिल तो धन्यवाद. Thank you for giving your time, and
Thank you,
we'll
sir.
stay in touch. Thank you very much. Thanks a
Thank
lot,
you.
brother.
Thank you
Thank
very
you.
much, sir.
Thank you.
Thank you so much, sir. And a big thank you as well to the principal, sir, the faculty members, students, interns, and participants for their enthusiastic participation and for making today's session such a success. We truly hope you enjoyed and benefited from today's webinar. And we also look forward to seeing you all again on the 30th for the final session of our World No Tobacco Month 2026 lecture series.
Yeah.
Kindly note that the feedback form has been shared in the chat box, and we request all the participants to fill it out before leaving the session. And the e-certificates will be also be provided to all the attendees after successful submission of their feedback form.
All three
Until
feedback
then,
forms within 48 hours or 1 week, and we'll focus on external participants first. And
yes,
students, we are very happy to see this attendance. Please keep it for the next session also. I think we must thank our moderator again, Dr. Sara, wonderfully moderated event, as did Dr. Kushi, and now we will have Dr. Srishti moderating the next event for us. The
yes, sir.
next event is at 5 p.m. on 30th. So before I should again thank Dr. Sara Puri, and
Thanks.
guys, we'll meet again at 4:30 p.m. on 30th for the culmination lecture of this webinar series, and I hope you really have learned a lot from this. Thank you very much. You
Thank
can
you,
leave
sir.
the session after you have filled the feedback form. Thanks a lot, guys.
Thank you, everyone. And until then, take care and have a great evening ahead. Thank you.
Thank you. I'll be closing this meeting in the next 5 minutes. Thank you, guys.